Welcome to Play Wonderland, supporting kids with cancer and sepsis through play. I'm Avery.
And I'm Leah.
Jumping right into our diagnosis, cancer in pediatrics. The term cancer refers to many related diseases in which some of the cells of a person's body divide without control or develop abnormally. If the cells grow without control, the result is the potential to invade other tissues. The type of cancer depends on the following tissue type, stage of severity, and site of origin. And some common signs and symptoms include unexplained weight loss, fever, extreme fatigue, pain, persistent headaches, skin changes. And some treatment is chemotherapy, radiation, and surgery. And there's a lot of different impacts on occupational performance, but I will list a few, which is difficulties trying to maintain a normal lifestyle, declines in play or leisure because of fatigue, lymphedema, or neuropathies. Treatment schedules, isolation due to treatment, and loss of interest may also impact one's desires to engage in play or leisure.
Now jumping into sepsis with pediatrics. So, sepsis is a condition caused by an irregular response from the body when attempting to fight off infections. Some common causes of sepsis include infection to the lungs, kidneys, bladder, digestive system, bloodstream, any wounds or burns. And then common symptoms you see include changes in medical status, shallow and rapid breathing, unprompted sweating, lightheadedness, or shivering. Then some common treatment. There's different medications that can be used to treat sepsis and septic shock, including antibiotics, fluid added to people's veins, vasopressors, or other medications such as insulin for blood sugar levels or painkillers. And then some supportive care that can be used includes oxygen. Some people may need a machine to help them breathe as well, or if a person's kidneys don't work well because of the infection, dialysis may be required. Other options include surgeries to help remove sources of infections, remove pus or infected/dead tissue. And then overall, there can be a wide variety of impacts on occupational performance. Individuals, if they have severe sepsis or septic shock, may need sedation and intubation, which could require significant assistance in performing most ADLs and IADLs.
The occupation that we had was play, which is defined as activities that are intrinsically motivated, internally controlled, and freely chosen that may include suspension of reality, exploration, humor, risk taking, contests, and celebrations. Play is a complex and multidimensional phenomenon that is shaped by sociocultural factors. From what we have learned in class, there is also play participation and play exploration, but I'm just going to emphasize the importance of play. So it's vital for child development, such as social, emotional, cognitive, lingual, and physical development, and it increases growth in attention, self regulation, and cognitive flexibility skills.
Now going into our motor learning and task-oriented frame of reference. So the motor learning frame of reference focuses on restoring an individual's functional movement through engagement in occupations. Through occupational engagement, individuals can develop their neuroplasticity, so their central nervous system can intake different stimuli and reorganize its activity. Through this motor learning, individuals can develop necessary skills or modify movements to promote occupational engagement. Function is present when individuals are able to develop motor skills, and these skills then become automatic, whereas dysfunction occurs when individuals are not able to reach skill acquisition and have to break down motor movements into smaller fragments.
Change is promoted through motor based occupation through doing, whereas motivation is meaningful tasks of the client's own choosing provide the greatest motivation for repeated efforts to recover and refine scaled voluntary movements in clients with acquired motor impairments. Before we get to the demonstration, I want to explain our intervention, which is a motor-based scavenger hunt. So step one, you would be engaging with a pediatric client and you are going to read off a trivia question to the client. This is related to Disney, kind of Pixar movie characters, but you can adjust based on what their interests are. And then at step two, you're going to have the client correctly identify the character and object, and you may provide helpful tips and hints to help get them to the character that they need to get to. And then step 3, you guys are going to find the character and reenact the character or dance to the song. And in our demonstration, we provide an example of kind of what that would look like.
Some important things to consider during the performance. Movement is encouraged through occupational engagement. Individuals can develop necessary skills or modifications of movement in order to promote occupational engagement. You also want to provide a just right challenge for clients, incorporating something that's motivating to them. Breaks are encouraged. Resting in a seated position or another restful position for equal or more time than the individual spends standing or engaging in fatiguing exercise is important. Repeating similar motions is shown to increase procedural learning, which helps acquire motor skills and habits. So making sure clients repeat the motion that they are doing. And then finally, this frame of reference encourages clients to problem solve on their own, to learn these skills, and then apply them to other situations. Hello everyone. At this portion of presentation, we're going to do a quick demonstration of what our intervention will look like. So we're going to have an interactive scavenger hunt. We're just going to demonstrate one time around, but this would be more repetitive with your client if you were to do it in practice.
Yeah, so I am going to be the therapist and Leah is going to act as the client, which is a pediatric client. And we're going to be doing a Disney Pixar movie kind of scavenger hunt to relate to her interests. So we're going to start. We're going to pretend like we already did the whole occupational therapy spiel as well.
Yep.
So, Leah, which Disney character sings Kiss the Girl?
Kiss the Girl. Okay. Is that in Aladdin?
It's not. It's in a movie where a lot of it's in the water.
Is it Moana?
No, that's a good answer though.
Okay. How about The Little Mermaid?
Yes.
Okay. So then who sings it? It's not the bird, is it?
No.
Is it the crab?
It is.
Sebastian?
Yeah.
Okay, good.
So that's what we're going to be looking for.
Okay.
So we can look around the entire space for where Sebastian might be hiding.
Okay. Not there. Can you help me?
Yep. Oh,
No.
not there. Good guess though.
How about this one? Oh, there's something here. There he is!
Oh, that's the crab. Okay, now we found that one. Do we want to pretend to be crabs?
Sure.
We can do crab walks like this, and we can listen to the song as well. So we can crab walk like this, or if that is too tiring for you two, we can walk like this, or just walk with our hands. We could do like the little crab, like this. He goes little crab walk walk. Or we could pretend to be mermaids too, because Little Mermaid.
Oh, I like
with our
that.
tails. Yeah. And then we can look for our next one too, or we could just listen to the song for a little bit and pretend to be crabs.
Sounds good.
Okay.
All right. So that was a quick demonstration of one part of the scavenger hunt. Usually there'd be a variety of questions. During this, we want to emphasize giving your client breaks in between rounds, giving time for repetition of movements. That's really important in this frame of reference as well.
Yeah, just encouraging them to get moving, but adapting to what they need because the patient has cancer, so they may be fatigued easier. Parents could use it at home throughout their house, but just kind of saying like, do we need to take a break before we look for the next character and things like that. But the repetition of finding items is a good way. So.
Yeah. Thank you for watching, and we will see you in class.
Now that you've seen the demonstration on the intervention, we're going to provide a little bit of evidence for our intervention. So engaging in meaningful activity enhances motivation and neuroplasticity. And Zwicker and Harris completed a study, and the results indicated significant improvements in motor skills among the intervention group compared to their control group that they had, which was just like a home-based therapeutic program. And it helped highlight the effectiveness of task-oriented approaches in pediatric cancer rehabilitation. Another study as well by Sahan, I think that's right, reinforces the task-oriented engagement to improve function. So this article emphasizes the importance of designing interventions that are engaging and relevant to the client's daily activities by promoting meaningful and functional outcomes. It also emphasizes the importance of incorporating motor learning principles such as practice variability, task specificity, and feedback to enhance skill acquisition in children.
In a randomized control trial, researchers wanted to understand the impact of structure active play on gross motor function of preschool age children diagnosed with cancer. They utilized the Peabody Development Motor Scale as a measurement tool throughout 6 months of the intervention. Results have yet to come, but researchers have emphasized that the findings of this study can help provide insight into the intervention group children and parents experience with structured play. And then in a systematic review, researchers investigated the effects of motor based interventions on children's physical activity and motor outcomes. Participants were included if they were diagnosed with leukemia, and it was found that children who engaged in exercise and motor interventions had improvements on fatigue during acute chemotherapy, and during maintenance chemotherapy, individuals had increases in physical activity, range of motion, bone density, and strength.
And then here are just some clinical reasoning Q&A that we are going to go over as well in class. And here